We have invited again Dr. Sam Dasanayake, who is an Ayurvedic doctor, who have just finished a series of discussions on some very useful topics in Sinhala, and who had also received a great response from his viewers. So, Dr. Sam, welcome to the show.
Hi, Brian.
First off, Doctor, I would like to ask you a little bit about a very prominent question that was asked by the viewers, which was about lower back pain. Are there any treatment, any Ayurvedic medicine for lower back pain? And also, how do you get lower back pain?
Yes, there's definitely a complete cure from Ayurvedic treatments along with Ayurvedic medicine, especially for any musculoskeletal issues and especially along the spine. So, cervical to the lower lumbar and thoracic region, any sort of ailment is completely cured in Ayurvedic medicine. And also for the second question, how do you get lower back pain? During now 10 years of my practicing here, I have identified many issues why people get lower back pain. One is because the main reason is the bad posture. So, when you are sitting down in an office from 9 to 5, if you are working in one position for a long period of time, that will give stress to certain areas of the spine. So, they are then subjected to wear and tear. So that is even in this office culture, it is highly advisable to stretch. Office ergonomics stresses the fact that you should get up and move about, do some stretches at least every 45 minutes. So these things should be followed. So bad posture. The other one is the repetitive strain injury. So if you are within your working hours, if you are repeatedly doing a certain thing, bending up and down or giving stress, moving in a certain direction repetitively, that also give a certain amount of stress along the spine. So we should find alternative work and not the same type of work, very important. So if we identify these patterns, then one should move away from this type of work or find alternative work. The third is injury, so which we can't actually predict. We can have an injury, you can have an automobile injury or injury at work that will give you a bulge disc or a slip disc. And the fifth is actually degenerative disease. If your family has a genetic predisposition of arthritis or osteoarthritis, then you are more prone to have spinal disorders. So collectively all these things could give you lower back pain, and as I said before, if you think you are subjected to these conditions and you see a pattern, and if you have lower back pain, and I think that time you should try to investigate more on any type of treatments along the Western side or Ayurvedic side.
Good, very good. And doctor, what are some of the treatments for lower back pain, and can the treatment be done while someone is doing a job?
Most certainly, we would not recommend we will not ask people to leave their job whilst on treatment. So we have made it in such a way that you can adhere and follow Ayurvedic treatments whilst you are doing a job. But one thing you have to be very careful is that if you decided to go on Ayurvedic treatments, you have to follow a strict diet regime. There are certain things that I would recommend for you to follow through, and you have to adhere to that very strictly. And second is that you have to follow the treatments. So treatments, you visit the clinic and do these oil treatments, and also the most importantly is that every night we give you a certain paste to apply along the spine. You can't be lazy and complacent about this application, because this is the one physically that will build the cartilage, and that is why we make a complete cure. If it is a bulge disc or even if it is a slip disc, we will make the cartilage slowly while giving the medicine. So you have to apply the paste in the night and remove it in the morning, and as the cartilage grow, you need to come to the clinic. So we do a complete spinal stretch and stretch the spine so that the disc would go into its place, whilst the cartilage will hold the disc in place. It will take about a month and a half in a normal circumstances, and then you will find that your pain is alleviating slowly, and that you would be able to get on and do things that you were finding it challenging before. Now, furthermore, after 3 to 4 months, you can take an X-ray and take it to your GP, and then let's see if he will still identify you with lower back issues. So that's the amazing thing that Ayurveda supports, is that we completely grow. We do not give any painkillers, so it's not the pain management, it is the complete cure for lower back pain.
Thank you, Dr. Sam. That was very useful, and we hope to see you again in another segment. Thank you.
Thank you very much.